Hey, what's up, guys? Listen, we got to talk some more about what's going on with Dr. Jackie. Now, if you guys don't know, well, I'm not going to say all, but a lot of bloggers that cover reality TV and people on Twitter and Housewives Twitter are saying that we should forgive Dr. Jackie. She apologized. That's the end of it. To which I say, baby, you're not gaslighting me. Do you know what I did? Since some people can't seem to understand why what she did was so bad or how what she did was so damaging, I literally got a compilation of her patients testifying as to the dumb-ish that she was a part of, the dangerous dumb-ish. But let me just say before we get into these testimonials, because I feel it's important to say, right? Everyone that doesn't want Dr. Jackie canceled, please go enroll into her health practice. Please show your IRS and your income tab to see if you are worthy of being treated like a human. Please, I would invite you. As to everybody else, you can join me on this side of history. Let me tell y'all something. I heard somebody say something. We need to support Black women. We do. But we need to support people to support us. If Dr. Jackie was anything but a Black woman, we would be crying out for the Biden administration to rip their license away. We will be diving into their patient history to see if their dangerous thoughts actually had any real world consequences. But because she is a Black woman who has clearly said time and time again, she does not want to stand among us. My opinion of Dr. Jackie, she finds Black women disgusting. We are obese. We eat bad. We're loud. We're dramatic. We're this. We're everything that Jackie's low talking and slow walking self thinks that she is above. Jackie does not identify with Black women. She identifies with the elite. She identifies with respectability politics. And even in respectability politics, she is willing as a trained medical professional to recite racist medical talking points that even the racist medical people have admitted are talking points, dangerous talking points that need to be dispersed. Now, listen, not y'all, but the people in the back might realize it, but Jackie realizes what Jackie did was dangerous. What Jackie did, because you gave racist talking points to justify. But even more dangerous was Jackie showed us what she thought. If you guys don't know, Jackie said that, Black women, you got to admit, the reason why we have a high morbidity rate during childbirth is, we're bad, we're obese, we do this and that. Even though Jackie's a medical professional, was being intellectually dishonest. Because let's be real for a second. The morbidity rates during childbirth account for comorbidities that exist. And even when you would account for the comorbidities and exclude them, it's still shockingly high. Jackie knows that. You talked with the VP, and the first thing you wanted to do, what you did 3 years ago, is say why we are responsible. And then she came out with her tearful apology. And I do believe she was in tears because at the end of the day, Jackie saw her practice slipping away from her. Jackie finally saw she went too far. Again, she wasn't trying tears of regret, because what did she say? What was the advice she gave us when we're like, Jackie, how can you repeat such dangerous rhetoric? That's like finding out a pilot drinks. One of y'all use this in the comments. Forgive me for forgetting who exactly. That's like finding out a pilot drinks before a flight every day. And you're saying, we need to forgive them. They apologize. No. Because there is no remorse. Jackie then said, the way we can avoid this is, you would misunderstand what I was saying. I'm saying Black women should learn to better advocate for themselves. Keep a journal of what you feel so you can reflect it accurately back to a doctor. As if you, as an adult in pain, cannot say, yo, I don't feel good. You need to bring a journal to prove that you're not trying to get a note to get out of work. The fact that she's saying, Black women do this, that's why people don't take us seriously. What is wrong with this woman? The fact that she said, bring a friend to advocate for you. So when I'm dealing with my doctor that I paid over my pain that I'm telling you I'm experiencing, right? I need to bring a friend to advocate for me because my voice isn't enough, or, so I don't get all hoo-ha and be dramatic. Jackie is insane. She is dangerous. Her rhetoric is not only dangerous, but if you listen to what her patients are about to say, it actually spells a lot of stuff out. And the people that literally are willing to overlook that and really ready to sweep it up, talking about we need to support Black women, baby, we need to support Black women that are down for Black women, just like we need to support men that are down for us, just like we need to support other races that are down for us. The fact that there are bloggers right now and people basically trying to gaslight us and convince us to mule for Dr. Jackie, somebody that don't even move for her own. Why did she get into OBGYN? Why? Was it a power trip? Was it an ego? She clearly don't got love for pregnant women for somebody here to even say that out of their mouth. Again, when someone shows you who they are, believe them. When somebody says some callous stuff, no, you haven't done anything to deserve forgiveness. You didn't walk it back. You didn't apologize. You said you were sorry for hurting our feelings and for the phrase of words. But maybe everybody defending Jackie feels the same way about Black women. Oh no, all skin folk ain't kinfolk. Anyway, y'all, let's get into what Jackie's patients say. Listen to the stories and then hit me up. Because the last thing I want to say is, do you know why, even though people are busy gaslighting, going up for a D-list reality star that don't deserve it because of the dumb shit she said? She lost all respect, all credibility. And I don't want to hear, oh, yeah, she a doctor. Baby, I'm surrounded by doctors. Even the doctors know how dangerous that is. I do want to say this, right? You know, with Jackie, with the dangerous things she said, with the fact that if she was a white man or a white woman, we would be calling right now. You know, a lot of the bloggers want to gaslight. They want to say whatever. But at the end of the day, Jackie said what she said, and she didn't back down. Ask yourself why you're okay with that. And ask yourself the people that are okay. And again, all skin folk ain't kinfolk. But honestly, you guys, listen to this and you will see, even though these bloggers want to gaslight, right? And I'm not throwing shade on anyone. I'm talking about anybody that's on TikTok or whatever, right? Listen to the real world consequences about the way Jackie talks and the way she feels. She feels this way, y'all. Okay. And if y'all want to go see her, fine. But like I said, it's a no for me, baby. And I don't care what color, race, creed, religion you are. It's going to be a no, 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 no. And if I have a chance to get you out, 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 I will. I will. I will. And if, listen, let's go.
Over my For You. Y'all, I'm seeing Dr. Jackie all over my For You page in regards to the comments she made about Black women, and I just want to give my 2 cents. I chose Dr. Jackie because, you know, she's in the Atlanta area. She was a Black female doctor, and knowing like the high mortality rate with Black women during childbirth, I wanted to feel protected, so I wanted a Black doctor. But honestly, this was the most traumatic birthing experience I could have possibly thought I would have went through. To make a long story short, the day I turned 38 weeks, Dr. Jackie decided to induce me because they thought my baby had a low birth weight, meaning they thought he only weighed like 5 pounds. I went to the hospital that day, not knowing that I was going to be spending the next 3 days in labor, in excruciating pain. And not only was it painful for me, it was painful for my child because his heart rate was going up and down, up and down, up and down, with them trying to exhaust every option they could to get him out of me. So when all their methods failed, they ended up telling me that I had to have an emergency C-section because his heart rate had got too low. And y'all, when I tell y'all I was bawling from the moment they told me to the moment they put me on a table, crying, couldn't talk, like I couldn't even open my mouth. After that was all said and done, weighed him, he ended up being 6 pounds, 8 ounces, meaning he didn't have a low birth weight and he could have stayed in me until he was ready to come out. Mind you, in those 3 days, I didn't see Dr. Jackie one time. Not one time did I see her. And I had my baby during COVID, so it was only one person allowed in the delivery room, me and my mom, and I was scared out of my mind, okay? Scared. And then my baby, like now he has like developmental delays, and I don't know if I should associate that with them inducing me, because personally I feel like if they let him cook a little bit longer, he would have been fine. But who am I to say that's correlated? But that's just my story and I'm sticking to it, and I will not be going back to her.
Well, this Dr. Jackie issue is not only it stressed me out, it really saddened me. Like I'm like really saddened by it. And let me give you all a story so you understand. I'm a healthcare provider. I'm a PA. I have my PhD in public health, so I'm big on educating people and trying to improve the health of the public, right? Well, as a PA, 8 years ago, I was pregnant with my son, and I went to the hospital after laboring all day. They told me, oh, you're not that far along. They did an exam. Lady claims I'm 1 centimeter. We're going to get back to that. This is on my second child. I'm not like popping out babies crazy where I'm going to have a quick birth. I just know that I've been laboring all day, and I know that I get to the hospital, I'm ready. It's my contractions are less than 2 minutes apart. I'm going to have this baby. They're telling me I'm not. They're telling me, oh, they put the thing on my belly. Oh, we're not picking up any contractions. I'm not crying. I'm not screaming. I'm just saying, I'm having this baby. I'm contracting. Hold on a second. Because I went to Lamaze. Breathe. Every now and then a tear rolled down my eye. But that was me. They didn't believe me. Okay? So Dr. Jackie's talking about crying wolf. No, I was calm. They did not believe me. I had my son in the hallway because no one believed me. I am big on promoting health advocacy and advocating for yourself, asking the questions that you need to ask, getting the answers, demanding the answers because you have the right to get those answers. And I'm so
Sometimes as Black women, we do have to speak up. So around September, October of 99, I got pregnant. I was working for Universal Circus. And one of my coworkers told me about Dr. Jackie, saying that she was Toni Braxton's doctor. We just got insurance. I was like, cool, I'll go to her. So this is my first pregnancy appointment ever. My baby daddy was like, well, do you want me to go? And I was like, nah, don't go. Go to the second one. The only reason why I told him that is because he asked a lot of questions and he be getting on my nerves. So I was just like, you know what? Let me just go to this one by myself. Well, that was a bad idea because as soon as Dr. Jackie came into the office, she was like, hi. She asked me my name, and that's when it just went downhill from there. She was looking at my records and she was like, oh, it looks like you're not married. I said, no, I'm not. And she was like, well, where's the father? And my naive self said, oh, well, I told him not to come. She asked me, so you didn't think that your first doctor's appointment about your pregnancy wasn't important enough for the father of your child to come to? Y'all, I went into that doctor's office feeling like this. But after she said that, I felt like this. She continued to be very judgmental and belittle me through the whole appointment, saying things like, if the father was here and if you was married, and she's saying these things as she's doing her OBGYN stuff. She kept going back and forth from being shady to being professional. And the more she talked, my self-esteem went from here to here to here. I just remember thinking in my head, oh, I gotta find me another doctor. We didn't have internet at my house at the time, but I just remember thinking, as soon as I get home, I'm going to go back into that big, thick book that they give you with all the doctors in it. I was going to go through that and find me another doctor. So I remember leaving the appointment with my due date and prenatal pills. Everything else is just a blur. I ended up getting laid off, so I decided to move back to our hometown to have our child. So I ended up losing my health care coverage and ended up having to go on Medicaid. I don't know what they did to Medicaid now, but back in the late 1900s, having Medicaid was the shit. I ended up going to this white doctor because I was just like, you know what, I'll just go to anybody after Dr. Jackie. And after that first appointment, I was like, yeah, I need to find me another doctor. I ended up going on different hospital tours, and I was highly recommended to another Black doctor at Baptist Health. Shout out to Dr. Mark Spence in South Miami. However, I did not have a good experience in the hospital because the nurses felt like I was being very dramatic whenever I had my labor pains. As soon as I saw the epidural person come in, I got quiet and I just started relaxing myself because I was not trying to get paralyzed when they were administering the epidural. So I got the epidural, and then the person goes and says, oh, well, I thought you were going to be a problem. And I was like, why would you think that? And they were like, oh, the nurses already warned me about you. And he was like, oh, well, they told me that you've been screaming the whole time that you've been here. And one of the raggedy nurses was in the room when he said this. So my mama turns to the raggedy nurse and the epidural man and was like, I've had 5 girls. So when you're having a baby, you're not supposed to scream? And that raggedy nurse looked at my mama and said, not the way she's screaming. And this was back in 2000, so I'm not surprised to see that Dr. Jackie said all of this about Black women when it comes to being pregnant. It's not only insensitive, but it's very dangerous. I feel like a lot of healthcare providers and Dr. Jackie do not think Black women are human. I think that they don't give a fuck about their Black patients. And there's a lot of greedy healthcare providers with a lot of hatred for their Black patients. And if you're a healthcare provider and you get offended by this, then you're exactly who I'm talking about.
Medicine just confirmed everything that the TikToker Selena told us a few weeks ago. That you have to have a level of professionalism. You have to have a level of morals, beliefs. There's nothing that can be taught when you come into the medical field. Because from experience, we know that there are many doctors, nurses, and there are some good ones, but there are some bad ones that just flat out don't care if you don't come from a certain class. Now, although the clip is 3 years old, we don't know what your sentiment is today. Because people are coming out saying right now that Dr. Jackie don't even accept you as a patient if you have Medicaid. How is it that you're joining forces with the VP of America, Kamala Harris, to push a program and ensure that Black women have access to Medicaid, especially while they're pregnant? There's a YouTuber by the name of Lakeisha Keisha. She explained to us, her audience, how she tried to book an appointment with Jackie, and she couldn't until she paid the full price prior to meeting her. She had to pay the full price for a first-time patient appointment. She had to put her credit card on file, slide it, charge it, then go. So that tells you what Jackie is all about. And I agree with Buffy. It is very dangerous that you, as a Black OBGYN, have these sentiments about your own kind, your own people. Am I shocked? No. But I'm happy she said it out loud because now we know. There are many stories about Black women going into labor and not returning home from the hospital because they complained to their doctor. They were having pain in their back, their neck. They were having headaches because the doctor did not believe them. They sent them home only for that person to become a spirit because people like Jackie didn't believe that they were actually in pain. My thing is, how can you determine if somebody is lying to you about their pain levels or not? You have to be a skilled doctor to be able to determine that. If you need an example of this, just look up Judge Hatchett's son. He's been advocating for his wife for years now. Back in 2017, Kira Johnson went in to deliver their first child. She complained of having headaches and pain. The doctor sent her on her way and she's no longer here with us today. Another thing that I find very interesting is that it was revealed during her meeting with Kamala Harris that Black women are dying at a 3% rate during childbirth. Because Black women, in specific, is what I'm talking about right now. Now, I don't know what other races decide to do. I just know what was a growing concern in my community. Because we knew that this was a growing concern amongst our community, some people decided to hire them a midwife. Do y'all remember how they started taking those people kids? Because they felt like they were putting their child in harm's way? Never mind the Georgia doctor, St. Tracy Julian, who unalived the child during childbirth because she used excessive force to remove him out of the birth canal. We're not going to even talk about that. I have more to say about the situation, but I want to hear back from y'all. What y'all think?
Hold on. Not me scrolling on TikTok. I don't know. Not me scrolling on. Let me get this straight. With everything that's going on with Black women in the health profession, okay, all the malpractice that's going on, the deaths during childbirth, the deaths during pregnancy, the death just being fucking sick. Just being sick because nobody's listening to what we're saying. You, as a Black female doctor, would get your ass up on Beyonce's internet and tell the world that we're faking it? That we're dramatic about our pain? Am I in the fucking Twilight Zone?
Happy holidays to you and yours. I'm taking a much needed pause to address comments that I made during a 2020 live interview with one of my castmates. First and most importantly, to Black women and mothers, including your friends, families, and the medical community who cares for you. Because my words left you hurt and feeling unsupported, I want you to know I hear you, I see you, I believe you, and I apologize from the bottom of my heart. I am brokenhearted over this. The guilt and reality that I have hurt and offended people, especially Black women, and some of my own patients, pains me to my core. As I look back over the 2-hour video again and again, I admit that I used the wrong words and descriptions to properly convey my concerns regarding maternal mortality related to women of color. But the fact is, we must do more because we are still dying more. If I could say it all over again, here's how I'd say it. When experiencing a health matter, keep a log of your concerns and symptoms so that you can provide them accurately to your physician. Have a buddy system, someone who can advocate for you when you're with a physician, especially when pregnant. Know that a second and third opinion is not just sometimes warranted, but necessary. I thank you for taking out time from your holiday to tune into my apology and my self-dedication to Black women and healthcare. I've been shaken and moved to be better. Happy holidays to you and yours. I'm taking a much needed pause to address comments that I made during a 2020 live interview with one of my castmates. First and most importantly,